I just want to thank you for the work, both of you, in terms of you personally, but the organizations that you represent for so many years. The question that I have is a little bit, aside, that I keep wondering and having concerns about how do we get the next generation of women engaged and involved, and as well as women who, many of whom I represent, who are not part of the mainstream as it relates to access to health care, culturally, language-wise, and so forth. And I know that Planned Parenthood has a wonderful peer education component where they train young people. And each time I have an event and there's young people talking to other young people, it works so beautifully. This particular group is just wonderful. They are being groomed as leaders in terms of advocacy, and for themselves as well as their peers. So I'm just wondering if you have some ideas for us as to what we need to be doing. Obviously, I'm a huge fan of school-based health clinics. I think that we have to figure out a way to provide health access to reproductive health services for young people in particular. But in addition to that, we haven't done that either very well, but in addition to that, what do we need to be doing to make sure that we have the next generation or so of women who understand the importance of advocacy as you're doing it today?
Sure. There's an awful lot of work that family planning advocates and our Planned Parenthoods do is side by side, shoulder to shoulder with our coalition partners, NARAL Pro-Choice New York. Actually, ACOG is one of our great partners as well, and the NYCLU. But I will tell you, the attacks that have been occurring down in Washington have done a lot of this work, jump-started a lot of this work for us, because there certainly was a time where people felt very comfortable and confident that the access to reproductive health care was very sound and solid. In New York State, the brave members passed the bill 6 days after I was born. So 42 years is a generally time-tested provision. Roe versus Wade is coming up on its 40th anniversary, and this is the perfect time for us to be discussing the fact that there are people across the country, and many of them are elected in the United States Congress right now, who do believe that the progress that we've made around reproductive health care needs to be rolled back. So I would tell you the constant conversation that's happened in the dialogue has increased the amount that many advocates have been able to get out to the public to speak to. But I would like to caution folks that the next generation is not complicit, and they are engaged. They're engaged in ways that are different than what we're used to seeing. As opposed to maybe traveling to the Capitol, they love Twitter and Facebook, yes, and they're very excited to be a part of it. And those means really are very active around reproductive health care. What the next generation would like to see is us to stop squabbling over sound policy that has been established and move forward in ensuring that education is available, that we can have sexuality education available in our schools from kindergarten through high school and beyond, that they have the ability to access that education in schools but also outside of school and basic community programs, so that they have the ability to access information that they need to make the best healthy decisions for themselves. This is not an attractive fight for people who believe that this shouldn't be a question of legislation. We need to settle this question and move forward on what we do not have, and that is a solid K-12 program for our students who are in school that is supported by community-based programs for our students who are out of school as well. Sabrina, did you want to add?
Sure. I want to echo a couple of things that Tracy said, and I'll embarrassingly divulge my age. I am part of that generation in many senses, and you know, I think that it's a different fight for them. Not only is their activism seen in different ways, but even the women for whom they don't consider themselves part of an official movement, I think they just look at these issues differently because for them, they've always been healthcare issues. It's not a rights issue. It's not something you march for. It's just something you expect when you go to the doctor. And frankly, I think the more we can keep talking about it that way and making it clear that this is a basic part of healthcare that women, young and old and in the middle, expect, the better off we're going to be. And I think the more we'll be able to reach communities for whom this isn't a march down the street with placards issue. It's just something they need to understand how to access, and maybe they need better access to, whether it's insurance coverage or just, you know, knowing where to go for contraception or GYN care or cancer screenings or abortion. And so I think it's very much talking to the communities who care about this issue, but maybe don't talk about it the same way that we do as a formal movement, about, you know, how does this matter to them? You know, what are the issues? Because in many cases, it's about access. And it's about financial access and physical access, whether it's young people accessing information in schools or low-income women accessing affordable services in their communities, that, you know, services they can get to if they can't travel and have kids that they need to find care for, have, you know, a job that's hard to maneuver around to get to a clinic. And so I think it's really about how we envision, and to link it back to the Reproductive Health Act for a moment, you know, it's a very real change that needs to be done to move our laws from the criminal to the health code. But it's also, you know, from a message and symbolic perspective, that's where this country has gone. You know, it was established as a right in New York in 1970, the rest of the country in 1973, but people understand it as health care. And I think that's how we need to be sure we're talking about it, because I do think that we'll reach communities who get it. They just don't talk about it the way that we talk about it often. And I think that's really critical, that we connect those dots.
And I thank you for that, and I will just say I'm always worried when I don't hear from people on issues like this from my district. So and I'm not a Facebook person. I'm not you know, I don't twit or whatever they call it, and so I'm not part of that conversation. But I do have a lot of interaction with especially young people in my district, and so they bring to me their issues because I really want to listen to them, and this is not what they talk about. And I just have a feeling it's not because they don't care, but it's because they have not been, you know, brought into this conversation, this movement, and they really should be. So I thank you for that.
And you know, I do thank you for your testimony as well. One of the things that was mentioned, I guess, Tracy, you were mentioning about the health exception. And both of these organizations are advocating for, obviously, the full range of reproductive health care for all the right reasons. But it's important that we also talk to the physicians and people who are really charged with health care. And to that end, we have Jennifer Lang, who is the legislative director for the American Congress of Obstetricians and Gynecologists, also known as ACOG. So thank you for being with us, Jennifer. And